Um, Hi, Dr. Divya.
Hello.
Hello, everyone. So today we have a very special topic because it's a very, it's a most common topic and issue a lot of people, whether it's teenagers, children going to school or colleges or people going to offices. I'm sure most of them, suffer from anxiety or any stress related issues are always there. Uh, you know, uh, at all stages or at all ages of life. So today we will talk about, we'll try to understand what exactly anxiety is and how can you manage yourself, how can you reduce maybe stress, or how you can manage your thoughts so that your anxiety or your mental health issues don't affect your personal professional life. Again, Dr. Divya will try to give you solutions that you can do on your own, but I'm sure she'll suggest that it's best to consult a mental health expert if you feel that the issues are going out of your hand. So first try to understand, because it's a very sensitive topic, so I request everyone to first try and understand what anxiety is, which Dr. Divya will tell us. And then if you have any questions, please feel free to add them in the comments and she will answer as much as she can. So Dr. Divya, if let's start, and maybe you can start with your introduction and tell us a little about yourself.
Yeah. Hi, good evening, everyone. I'm Dr. Divya. I'm a consulting psychiatrist with Fortis Hospital. And like she told you that I'm here to discuss about what is anxiety and what are the various kinds of anxieties we see, we feel, and we see in our patients, and some tips that can help you overcome them till they don't interfere with your daily life.
Yeah. So let's start, and I have the most basic question. A lot of when you go to any online platform or to a doctor, they suggest that you should go to a therapist, and sometimes they suggest that you should consult a psychiatrist. So what is exactly the difference between the two?
Okay, see, before we come to the difference, the most important thing we have to understand here is that both the therapist and the psychiatrist, they work with one goal. And that goal is to treat you with your suffering, with the mental health issues or the mental health illness that you are having. So that is their main aim. So what happens in a psychiatrist is basically one who has a professional medical degree, like a doctor. He's basically, he or she is a doctor who talks to you, who diagnoses your problem and gives you medications for the same. Like, if you go to a medicine doctor or general physician, they give you medications. Similarly, a psychiatrist is the one who has an MBBS, MD degree and who can treat you with medications by diagnosing your illness. A therapist does the same, but usually goes into all the therapies and counselings. But again, a psychiatrist can do both.
Hmm.
So, like I said in the beginning, their main aim is to treat you with your mental health illness. So,
Okay.
I would suggest, before being confused whether to go to a therapist or a psychiatrist, the best suggestion is go to the mental health professional who's available with you readily in the
Hmm.
hospital or in a nearby clinic. So rather than thinking and waiting whom to go to, it's always better to go to the first person who is available for mental health illness treatment.
Okay, okay. So, because I'm sure a lot of people are confused, when you go to any online website, also, they see there are psychiatrists or neurologist or therapist. So, like, what to do? Who should, you said that the person should be readily available, but who can actually diagnose your anxiety? If you have to name one, therapists
See,
or
a
psychiatrists.
psychiatrist is also very well equipped, can
Hmm.
diagnose your anxiety. A therapist
Hmm.
can also diagnose your anxiety. Their line of treatment is only different.
Difference.
There are
Okay.
times when a therapist himself or herself might feel that you require medications also, because as a psychiatrist we work with the neurochemical imbalance that starts happening with the mental health illness that comes up. So
Hmm.
when we are working with the neurochemical imbalance, we need to give the medications in a lot of patients. So it's important to take the treatment, go ahead, take the treatment, let the professional who's sitting in front of you decide whether you
Hmm.
need medications, you need a therapist, or even if you need a neurologist also. I think they
Hmm.
are well equipped, they are well, They are well educated to understand and help you out.
Hmm.
So people
Hmm.
usually waste their time in thinking whom to go to, but it's always better not to waste your time.
Okay, okay. So let's go ahead with the second question. What, like, because this live is about anxiety, so let's understand what anxiety is.
Okay, see, if I tell you in the medical terms, what is anxiety is basically an emotional response that our body shows both emotionally and physically to any uneasiness in the anticipation of any kind of fear for the future. It could be fear, it could be anger, it could be even worry. That is when anxiety starts coming up. And when we call it a mental illness, is when it starts interfering with your daily work. A simple
Hmm.
thing at times, to get up and go for work, the person starts becoming very anxious, very scared. So that is when we start thinking that, okay, this anxiety is going ahead and it needs to be treated. So that is the time you should get up and take some help. So that is what anxiety actually means.
Hmm. And what is the difference between anxiety and depression?
I'm sorry.
What is the difference between anxiety and depression?
See, anxiety is completely different and depression is completely different.
Completely.
Depression
Hmm.
for us, what happens is that, people use it, you are sad, you are depressed. It is not like that for professionals. We have to look for your signs and symptoms. Symptoms like you're not able to sleep at all. You are, very sad, have a low mood most of the time in the day. Maybe the hobbies like you enjoy doing before, you do not feel like doing that. Sometimes even the thought of getting up from the bed in the morning is very difficult. You
Hmm.
have erratic sleep behavior. There are people who are sleeping the entire day and there are people who are not sleeping at all. Your appetite starts becoming haywire. You might eat more, you might eat less. You have these unexplained crying spells. Even sometimes they say that we are with the family, but we feel alone. We feel like crying. Okay, there are a lot of ideas where you feel that everything is helpless, everything is worthless. And yes, that is the time when suicidal ideations, the thought of suicidal attempt also comes up. So these are the
Hmm.
signs and symptoms that we see in a patient, which are there for a minimum period of 2 weeks. That then we start thinking in line of depression. Similarly, with
Okay.
anxiety, they are basically, sometimes they go hand in hand. The person starts feeling very restless, starts feeling very anxious, has, these sweatings. At times it's palpitations. They say, "Yeah, we can feel our heartbeat." If like we have to just talk to someone, like a social anxiety, like a generalized anxiety, we cannot do that. We
Hmm.
try to avoid that situation. And this happens to such an extent again that the daily working also that person gets hampered. Someone
Hmm.
who was, maybe very confident in giving presentations in the office is avoiding it now. You start becoming sweaty, jittery. So even if you have worked on it, you're not able to present it to your best. So that
Hmm.
is when we start thinking in lines of a person suffering from anxiety. And anxiety and depression can even coexist in one person.
Hmm. Hmm. Okay. So you just mentioned about social anxiety. What are the different types of anxiety? Can,
See,
like, is there a category or
there are
classification?
a lot of anxieties. Yes, we classify them in many ways. Social anxiety is one of them. Then we have a
Hmm.
generalized anxiety disorder also. Then we have this obsessive compulsive disorder that comes up. Then
Hmm.
sometimes we get panic attacks. That's also a part of your anxiety disorders. Then you
Hmm.
have post traumatic stress disorder. That is also considered a part of anxiety disorder. Your phobias are also considered a part of anxiety disorder.
Hmm. Okay. And out of these, which one is the most common that you've seen, like a lot of patient coming through because they have social anxiety, or they have panic attacks, or they have like a mix of these things?
See, basically,
How
what
does that?
happens sometimes with general anxiety and social anxiety, panic attack also comes up.
Hmm.
Right. So it's they basically all go hand in hand. So when the patient comes to us, we have to talk to the patient, understand the symptoms, and then we diagnose the person. So nowadays we see a lot of social anxiety, especially after the pandemic, when
Hmm.
people were completely locked in the house for almost 1 year plus 2 years. So
Hmm.
a lot of social anxiety, a lot of generalized anxiety has also come up. Panic attack has also increased. And yes, we know that COVID had created a haywire in our life. So
Hmm.
post-traumatic stress disorder was at particular time at its peak initially. The
Hmm.
first and the second wave, it was at very high peak, yes.
Okay. Can you tell us a little more about, the symptoms of social anxiety and general anxiety? Or like you said, that post-traumatic stress is also been increasing after the pandemic. So if one has to identify, because, self-awareness is important, then only we'll go to a professional for help.
See,
So, yeah.
I will not tell you everything categorically, but I'll give a
Correct.
general idea, because
Yeah.
what happens is, then people try to diagnose themselves. So
Hmm.
that is where the problem comes. So see, if you feel that, when you get up in the morning, there's a feeling of uneasiness in you. You start
Hmm.
having these unwanted or unexplained tremors in your hands. You are sweating. Maybe just the thought of, getting ready and going out for work, you
Hmm.
start contemplating what will happen. I have to talk to so many people. If I'm taking a public transport, I have to, wait at the bus stop or wait for the auto rickshaw. I have to make some kind of, communication with that person. Just the thought of it, not reaching also to the point, but just the thought of it starts making you feel very anxious, very restless.
Hmm.
Sometimes there are physical symptoms when you start sweating a lot, you start trembling. At times
Hmm.
people feel as if, they feel as if, that they will just fall down at the same minute. They become
Hmm.
so anxious and restless. So that is when we say that, yes, you are suffering from anxiety, and it's better that you go for a professional help, because these are all curable diseases. Like if you're suffering from diabetes, hypertension, we never wait. We want
Hmm.
to get cured at the earliest. We want to start the treatment at the earliest. But what happens with anxiety and all is we start thinking that, it will just go away. But make sure that if it's hampering your daily life, that means it is turning into an illness which needs to be taken care of like any other physical illness.
Right, right. So, I have seen, personally also, with my friends, that they are aware that something is not right. They are not able to get out of the bed, they are not able to focus on their work, but they also are not able to reach out for help, right? So, I mean, they are self-aware, but the first step, taking the first step or any step for that matter, is difficult. So, what is that one suggestion that you would like to give to these people?
See, first important is communication. Talk to someone. If you
Hmm.
cannot take that first step, you cannot go to the hospital, you cannot meet a professional at that time. So, the
Hmm.
best thing that you can actually do is talk to someone you are very close to. Now,
Hmm.
that someone can be, your family members, or maybe your sibling, or even a close friend,
Hmm.
someone you are comfortable in talking about your feelings. Then that person can actually help you. Sometimes we just need a little push, or maybe
Hmm.
someone to hold our hand to take us to the hospital, to take us for that help.
Hmm.
Because there, I understand there is a lot of stigma with it. People do, feel scared, they are hesitant to go. But when you know that you are not alone, there is somebody to help you and support you, then taking help becomes very easy. So, communication, talking to someone about your emotions, your feelings is the first thing that we can do.
Hmm. Hmm.
And
Okay.
I think if you are suffering from this mental health, and you can talk about it. Everything is online now. People are writing blogs, people are doing something or the other. So, if you have taken treatment, you can either talk about it or you can write it in the blog. So, when the
Hmm.
other person who is suffering from an anxiety disorder understands and takes help.
Hmm. Okay. Okay. So what else, like if we have to talk about, like you said, one point is that communication is important. What else can we do on our own, and make ourselves ready for the treatment? And plus, along with the treatment, if you have to give some generalized solutions that people can follow for social anxiety or professional anxiety.
See, most important thing is this, that you have to understand that like any physical illness, mental
Hmm.
illness can also is an illness which has
Hmm.
to be treated. So,
Right.
like I said, like, if you have diabetes, you have a thyroid issue, or let's say you have any other issue, you would get up and go to the doctor. So
Hmm.
the first important thing after communication is that get up and take help. Do
Hmm.
not think that like our body is one physically and mentally we are one person. So it's not that that if you have diabetes you cannot have anything else. The body acts. If you don't have anxiety, you will not have any other physical illness. There
Hmm.
are studies which have shown so many medical illnesses being correlated with mental issues also, or
Hmm.
with so many physical illnesses, mental issues come up, and vice versa. So there is no point in waiting till it becomes uncontrollable, becomes very difficult to handle. And
Hmm.
small tips that you can actually take is when you feel that you're becoming very anxious, especially while talking to someone or while going to present something. So first, something is important is that be very proactive. You should know that okay, I get anxious, I get restless when I have to do a presentation or talk to people. So do not leave your things, do not procrastinate till the last minute. Make sure that you are thoroughly ready and prepared at least 2 to 3 days before anything that has to be done. It could
Hmm.
be a presentation, it could be a meeting that you have to attend where you have to have things with you. So what happens is that half of you, when half of the work is done, your brain is at peace. The brain knows that I have done this much work. The next step that comes is that when you know that you're already ready with the presentation, a small amount of your anxiety levels go down. When you have a presentation, most important is please do not skip your breakfast or your lunch, whatever meal is there. And having cups and cups of black coffee, black tea will not help you at all. In fact, it increases anxiety levels.
Hmm.
Smoking is known to increase anxiety levels. So, most important is start cutting down on these things. You cannot
Hmm.
stop at a go. Take help, but start cutting down on these things. Have a good, healthy meal before you present. So, you are better, your mood feels better. Like we say, when we have a good meal, we feel better. So,
Hmm.
same thing for anxiety also. Take deep breaths. Till the last minute, do not keep going on your presentation. Sit down calmly at a place. You're getting anxious. Try to focus on your breathing for some time. So these are some things that you can help out yourself. And if you feel that I need some kind of help, maybe you can speak to your friend and present whatever you're going to present at that time in front of them. So that also gives you more confidence. And when
Hmm.
you're going out to talk to people, you know, just the way you present yourself in the mirror is what you're going to present yourself to people in front. So before going to the work or going out, generally just speaking to people, look at yourself in the mirror, take some deep breaths, smile, and say, I can do it, and go ahead. So
Hmm.
these are some basic tips that I think can help a lot of people.
Hmm. So I think the mirror activity that you mentioned is a very helpful activity. I feel. I think when I was a kid, people used to say before our big debate or before our speech, you should stand in front of the mirror, try to recite that thing, be confident, smile. That you'll feel that confidence within you once you see yourself smiling. So, are there any such techniques, like more techniques, like the mirror technique I'm aware of?
See, mirror
Anything?
technique is one of the most, effective things we tell people, because
Hmm.
what happens, especially when the person is suffering from social anxiety or phobia, they have a difficulty in talking to even their friends.
Hmm.
So what happens is when they're talking in front of the mirror, they are comfortable, they are at ease. And when
Hmm.
you're looking at yourself, you know what your body language is and how you're going to present yourself. So that gives you a confidence. And
Hmm.
other such kind of techniques, like I told you, is start presenting in front of people when you're more comfortable with. So, even if they tell your mistakes, you don't feel bad. Even if they criticize something or tell you something, they are preparing you for the major thing that's coming up. So these are few things that you can actually do, and it really helps a lot. So in the school also, that debate was what? It was again to boost up your confidence.
Right. Hmm.
So what happens when you're boosting up your confidence? Your anxiety is automatically going down, because
Hmm.
once you get that dose of confidence in yourself, there is no anxiety. You're sure that what I'm going to do is absolutely fine. So
Hmm.
that is how it helps.
Right. Okay. One last thing. I think because of the social media, a lot of people are aware about the affirmations, right? So, like you just mentioned about the confidence that you do, whatever you do in front of the mirror, it's all about confidence. So, how can one inculcate affirmations in their lives, and how affirmations can actually, have some effect on your mental health?
Okay, the best way of doing this is like you said, positive affirmations really help a lot.
Hmm.
So, you know, what I also suggest is that always when you're on social media, we're trying to look at something that's very emotional, that makes us feel very sad, very upset, you know. Instead
Hmm.
of following all those things, try to follow those things which are more positive, which gives you more self confidence. And the best thing you can do is pick up small quotes, or you can even make your own quotes. And the quotes need not be like, you know, 7 lines or 8 lines, just 2 lines, and
Hmm.
stick it in front of you, like maybe your mirror, maybe your laptop, maybe your workspace. So instead of always having something or following something negative, you are trying to train your brain to look at that quote, feel good, and train yourself to be something positive.
Hmm.
You know, it's easy for us to think that's emotional, that's negative, I get drawn to it. It's not like that. It's because we're training our mind to do that. The minute you train your mind to think and look at something positive, your mind ultimately will shift there.
Hmm.
If you like to paint, put up some nice paintings of your own. So when you get up in the morning or when you're feeling low and you see them, you feel happy. So I think the best is put on some nice quotes or maybe some nice smiley faces at your workstation. That makes you feel happy when you're working.
Right. Okay.
And spend time
Uh,
with your friends. I think that's very important.
yeah, I'm sure that's very important. It just changes, like initially you said it, right? Communication is important. So once you just
Yes.
start letting your feelings out, it makes you a little calm. Maybe not that better, but it will, like, it's just like a
Yeah.
first step. Being around people is first
Yes.
step.
And I think one more important thing is that, you know, we become anxious because when we are working too much. So
Hmm.
take a break and take care of your own self is very important.
Right.
We have an excuse, you know, most of us have an excuse, we don't have time for ourselves. But, you know, I always tell my patients 24 hours, you can take out at least 15 minutes.
Hmm.
So 15 minutes for yourself, you know, you will feel, you realize that anxiety level, that everything goes down. So taking
Hmm.
care of self is also very important.
Right. Right. Okay, thank you so much. I think it was a very informative session, and it
Yeah.
will stay on the community and our YouTube as well. So please go and watch the live session again. For any tips, you can also comment, and I'll ask Dr. Divya to give some answers if there are any comments.
Sure.
So anything else that you would like to say, Dr. Divya, before we close the live?
Um, all I can say is that, you know, mental health is very important, just like physical health. Do not neglect it. Our
Hmm.
body functions as one unit. So we need to be physically and emotionally fit to carry out our daily work. So do
Hmm.
not neglect mental health. And, you know, most important is talk as much as you can about mental health. Like I told before also, if you are suffering or you have taken treatment, talk about it. It's
Hmm.
like, you know, a ripple effect. Like when we throw a stone in the ocean, the ripples come up. So one person starts talking about, you know, it's an effect. Everybody starts talking about. So this time, right now, mental health needs more of unashamed conversation around it so that people come out and take help.
Hmm. Okay. Thank you so much. It was a very
Thank you.
nice session. I hope we do such sessions in future so that people can know more about anxiety or mental illness. Thank you so much, Dr. Divya.
Thank you.
Okay, bye bye.